Hi. Today in this a very important short video, I'm going to explain the five most important supplements everyone need on a regular basis. So before I'm going to explain, please understand there are multiple supplements available in the market. Some supplements are available only through pharmacy through doctor prescription, and we call them as a pharmaceutical supplements. And some supplements are available generally, like in general online stores like Amazon. We call them as a nutraceutical supplements. So the only difference is the pharmaceutical supplements, while they're manufacturing, they're usually well regulated by government agencies. Nutraceutical supplements doesn't have a regulation. It is just like another a nutrition product. Some supplements you can take only through doctor prescription and pharmaceutical supplements, and some things you can take in the nutraceutical, but always go for a trustable and reputed brands. So here are the first very important five vitamin supplements we need regular basis. The first is vitamin D. Vitamin D is naturally available in sunlight, but unfortunately, because of the lack of exposure to sunlight and eating a less nutrient dense food, almost 50-60% population nowadays have vitamin D deficiency. So vitamin D supplement should be taken only depending on your blood levels. Taking unnecessarily also can lead to toxicity. So at least once in a year, check your vitamin D, and depending on the values, you take the supplements. Suppose it's a very severe deficiency like less than 10, you go for an injectable forms. If it is 10 to less than more than 10 but less than 30, go for a nano liquid suspensions or a capsules, and take with a prescription of a doctor for how many weeks they prescribe. But don't take unnecessarily. Taking unnecessarily every week also might lead to a toxicity. Next comes vitamin B12. This again a very, very important vitamin for the body strength and nerves. Vitamin B12 is a catalyst which converts our food to energy. So people with a vitamin B deficiency commonly complains of fatigue, some nerve irritation, and in the old people it can even lead to some memory issues and all. One of the very, very important vitamin in the body, it can lead to multiple, it takes place in the multiple biochemical reactions. Vitamin D supplements, even if you take excess, it can be excreted in the urine, it's not harmful. But the best thing practice is check them at least yearly once, both vitamin D and vitamin B12. And again, if you have a severe deficiency, you may need both injections as well as tablets. And sometimes you can only go with the tablets. But injectable form, the absorption is better because vitamin D is absorbed in only a small part of the intestine called as ileum. So even people eating non-veg have a vitamin B12 deficiency because there is a problem in the absorption. Your vitamin B12 is not absorbed through the intestine. In such cases, if you take only tablets, then again it may not get absorbed. So always when you have a deficiency of vitamin B12, doctors prescribe you both injections as well as tablets. So this is again a second most important supplement. Third comes magnesium. So many people are not aware of the importance of a magnesium. Magnesium is one of the very, very important supplement because of late over the years there is a degradation in the soil quality that in turns lead to a magnesium deficiency. So magnesium is one of the very important mineral which is linked to most of our health. For example, people with a magnesium deficiency can develop a hypertension BP. Magnesium is the one which relaxes our arteries, because even like arteries also have muscles. By relaxing our arteries, it can reduce the BP. People who have a borderline hypertension or have a poor metabolic health can have a magnesium supplement every day, at least for 3 to 4 months. And magnesium is a relaxant; it reduces your stress. So, there are various researchers papers on this. Magnesium glycinate is the best form for the absorption, and Depending on your clinical condition, you can take a magnesium glycinate 200 to 400 mg again with a prescription of a doctor. Fourth comes omega 3 fatty acids. So commonly found in fish oils. Omega 3 fatty acids is commonly there in the fish, vegetarians, walnuts, flax seeds, and all. And that's again, omega 3 is one of the very important anti-inflammatory food substance. It's good for your heart health, and it can take even a nutraceutical supplement through fish oil capsules, or if you are eating a fish, you take regular fish, walnuts, and flax seeds. You can get omega 3 fatty acids. The fifth and important is probiotics. So nowadays, your gut health is very important for your overall health. And our food technology is like people for any food preparation, they eat lot of ingredients. There are syrups, sauces, and there are some chemical ingredients, coloring agents, and processed foods. All this will spoil your gut, can lead to a gut dysbiosis. So that in our society now, just like in the olden days people are taking multivitamin, now people need a probiotics also on a regular basis, because if you have a good gut bacteria and a good gut health, your overall health will be good. Again, this is available in a liquid suspensions and a capsules. I advise to take a pharmaceutical supplements with a advice of a doctor, depending on your lifestyle and clinical conditions. So these five supplements are very very important, and there are many other supplements also, like a calcium. Many people think that only calcium is important, they keep taking calcium for lifelong. Many people think that only multivitamin is important, that they takes some multivitamin brand like is because also supporting for lifelong. That doesn't give you any benefit. Periodically, depending on the clinical condition, take these supplements. You need not take all these five supplements together. These supplements, take it only on the if you have a deficiency. Magnesium supplement you can take weekly 3 to 4 days, preferably in the night. You can take omega 3 fatty acid weekly 3 4 days. Probiotic depending on the need basis. Suppose if your gut health is not good, you're traveling, you're eating outside food, you're eating more processed foods, you have some bloating, use a probiotic. So depending on this use these five supplements on a regular basis, on and off. So don't be in a competition that I should take all these five supplements every day. That means five capsules, five items. Imagine for somebody who is having diabetic or hypertension, they're already having 4 5 medications. If they continue to take this again, five supplements, it will be another huge list. Don't do that. Depending on the need basis, but make sure that in a whole year you take this at least 2 months, 3 months like this, so that you will not get deficiency. But as far as possible, try to supplement this naturally. As I said in the beginning, supplements are only a complement to your good nutrition and a good lifestyle. Supplement won't replace, and it won't be a substitute for a poor lifestyle and a bad diet. Apart from this, there are other supplements are there, like ashwagandha. Ashwagandha is like a stress buster. It also 5,000 hair history is there, and it will also hormone regulator. And every day in the night, 1 to 2 grams in a honey or a milk, it can be taken. Again, it need not be daily. Collagen supplements, it is good for your skin, and people who go for a gym and other resistance training, they can use occasionally. Again, calcium supplements, many people use calcium for lifelong, need not be. Calcium supplements also, use it on and off depending on the requirements. Again, turmeric. India, we are blessed to have a turmeric, a spice, which is, some researchers says, which can prevent the onset of Alzheimer's disease. So Alzheimer's disease is very common in the Western world. So people there eat less turmeric, they are more prone to Alzheimer's. We are India, the Alzheimer's is less compared to Western countries because from time immemorial we are using the turmerics. Turmeric is also anti-inflammatory, anti-cancer spice. It's one of the superfood. Again, nicotinamide booster. This is specially of a good research papers on elderly people. It will slow down the aging. Again, don't take the supplements on and off. Take with a prescription of a doctor. Coenzyme Q, berberine. Berberine is like it improves the insulin sensitivity. Somebody is pre-diabetic or type 2 diabetic with a high insulin resistance. Berberine may help. Again, take with a advice. And zinc. Zinc will cause good for the body immunity, one of the very important mineral. And resveratrol, it is commonly there in the red grapes and red wine and all, and it's a good antioxidants. So all these are needed, but you cannot take everything together. Depending on your clinical conditions, your metabolic health, depending on the need basis, take the supplements with a advice of a your doctor and a good lifestyle expert. That's it.